Hi, my name is Robin and I'm a level 1 nursing student. My clinical instructor has assigned me to observe you today.
Excellent. Feel free to ask me any questions you have.
Thank you so much. I look forward to learning a lot. So you're taking care of the patient in room 347. Do you have time to give me a report?
Of course. The patient in room 347 is Mary Cohen. Her doctor is Dr. Smythe. She's a full code. She's a 50-year-old female with no known drug allergies. She came to the ER complaining of abdominal pain and diarrhea, and she was admitted. She has a history of pseudomembranous colitis. She denies any pain right now. She's alert and oriented ×4. Pupils are normal. Skin is intact. Breath sounds are clear. She denies any problems with her breathing. She denies cough. She denies any problems, cardiovascular problems or history of cardiovascular disease. Heart sounds are normal. She's currently NPO. She's had diarrhea for 4 days with abdominal pain. Her bowel sounds are normal active ×4. Her abdomen is tender with palpation and I can feel no masses. She denies any polyuria and nocturia. She self-voids and her mucous membranes are pink and moist. She has an IV in her right arm with dextrose 5 1/2 normal saline running at 100 milliliters per hour, and she has a medication, metronidazole, that is due, and she's currently getting morphine and Tylenol PRN, and her last vital signs were temp of 100.8, heart rate 88, her oxygen was 100, and her blood pressure was 142/86.
Thank you so much for giving me a report. Do you mind if I ask you a couple of questions regarding the med administration, then watch you demonstrate giving the med in the patient's room?
No problem at all. What questions do you have?
Why specifically is the client receiving this medication, and what action does the medication have on the body?
Metronidazole is also Flagyl. It is an antibiotic. It works by disrupting the synthesis of DNA and proteins in susceptible organisms, and it's mostly used for abdominal infections, gynecological infections, skin infections, and she's getting it because she has an abdominal infection.
When should you question administering this medication? Does the medication have a therapeutic serum level? Which vital signs must be monitored? And which physiological parameters should be monitored when the med is being administered?
I would question giving the medication if the patient was allergic to it or if they didn't have an active infection. Vital signs that should be monitored are temperature and signs and symptoms of infection. And those are the things that I would monitor, is whether they were getting better or not.
What interventions must be taught to the client to ensure the medication is administered safely in the hospital setting? And what interventions must be taught for taking the med safely at home?
The main thing with Flagyl is that you cannot have alcohol with it. If you have alcohol with it, you will projectile vomit, so we don't want her to have it. And it's an oral medication, so there's no special ways to take it at all.
What are the side effects and potential adverse reactions?
The side effects of Flagyl are dizziness, headache, nausea, and then there's some GI distress, some abdominal pain, diarrhea, and dry mouth, which can be easily fixed with gum or candy, things like that.
How will you know the medication is effective?
She would no longer have any symptoms of the infection, so she would not have any abdominal pain anymore, and she would not have any diarrhea. And do you have any questions for me before we go and administer the patient their medication?
No, thank you so much for answering my questions.
All right, so let's go ahead and pull her medication for Mary Cohen, who is 50 years old. And we're going to pull it. We're going to check to make sure it's the right med, the right time, the right route, and the right dose. It's 500 milligrams is her dose. And make sure the medication is not expired. All right? Can you hit pause for a second?